The concept we're going to focus on is huddles. Huddles are something that we've noted and found in a variety of formats in a healthcare setting. Just to spend a minute on this, huddles are nothing but typically a cross-functional group of people coming together. This could include, as I said, doctors, nurses, care managers, social workers, sometimes even guardians and parents of patients coming together, typically in a synchronous fashion, like a short meeting. The way these are done typically in a non-digital setting. This is something which would include things like rounding, people moving from room to room, or this could be a hybrid situation where people have dialed in into a call being placed from a certain location. Usually in a huddle, there's a clear visual representation of tasks and goals for the group. So I'll share some examples with you. But the key concept here is we want a way for people to divide and conquer a problem. Now, this problem could be something related to solving a patient's issue, something related to diagnosing a patient. This could be something administrative or something to that effect. Dividing and conquering that problem typically requires updates, reviews, steps, documentation. Huddles also sometimes require team building, so we can spend some time on that. But the core aspects of the synchronicity of this communication means that people are interacting in real time and that human element is also present. In healthcare, we've studied these four huddle types in much detail. We've studied discharge planning, safety huddles, readiness huddles, and tiered escalation huddles in much detail. So think of these four as the templates that we'll present in this session. Just to give you some examples, these are pictures taken from some of our customers. This is what a huddle board might look like on a hospital floor or on a clinic floor. You'd probably be able to relate the fact that there's a bunch of action items noted down by more than one contributors. And most of these action items are, again, divided and conquered by different people. There's also data from different sources which is being picked up and displayed in what I would call these widgets or applets, especially in the middle visual that you see over here. And these data sources are totally disparate, often disconnected. Somebody is responsible for populating and surfacing those for others to be able to work on. So what we'll do is we'll do a crawl, walk, run approach, and we'll see how we can digitize some of these in effort to best make inclusive and efficient huddles. So the building blocks of a huddle, remember, we looked at 4 points. So the first point is a place to meet. And the place to meet in this case, in our case, is often going to be Microsoft Teams, most likely a Teams meeting. We need a place to capture a backlog or an audit trail of data coming from different sources. Some of the most simplistic implementations of huddles could be set up, as we've seen at different customers, in a OneNote or in an Excel file. And then as far as recording for auditing, people tend to record their meetings as you would a typical Teams meeting. You need a place to assign tasks and follow up. What we have out of the box, as most of you know, is capabilities for planner, tasks, and tagging. And tagging could be role-based. So how do you bring that together in a way that flows, in a way that's seamless? That's something we'll try to talk about. And then finally, you need a way to review, reflect, and improve. So out of the box, again, we have the concept of persistent chat. We have the concept of meeting notes, recordings, Power BI dashboards, and so on and so forth. Let's stitch it all together. What we found is often that a crawl, walk, run approach is the best in order to get fruitful results. Digital transformation typically does not happen in a single swipe. So what we propose is to build in a way that feels natural. We've gone through this process for all of the four hurdle types that I talked about previously. So if I could just simply take it apart, the crawl approach or the initial approach, or probably level 0 or 1 from the maturity model standpoint, is when you have a working group that lives in a team where people are self-identified with tags. And then the actual backlog and task list is maintained on Excel or a OneNote. Level 2 or level 1.5 in some cases is an extension of that where the task management happens in a planner or Outlook tasks or lists in a team. Issue tracking and velocity in that case is tracked in the respective application. And then there's an optional connectivity with Power BI to study some of the aggregate statistics. However, what we're going after is level 3 or the run stage, where we want real-time data to be pulled from the EMR ideally or any other data source. The tasks that are assigned, um, they could be reviewed together, and those tasks should be pervasive in nature. And then the notes, comments, or any data written down corresponding to those tasks goes back to the system of record, right? So not only does it live on the huddle board, if needed, it can be written back to a place which is deemed as a system of record in a healthcare setting. So I'll just share a couple of examples with you. Remember, I talked about 4 different types of huddles. What's common in healthcare is a multidisciplinary or an interdisciplinary round, an MDR or IDT huddle. These are huddles that happen at all levels in the organization. So what I'll just simply focus on here is 2 concepts. One concept is that of working out loud or working out in the open by way of creating something that looks like a Kanban board or something that looks like a record keeper of different sorts. Now, in this case, in my example that you see on the screen, the readiness huddle is created on a SharePoint list with custom fields created by individuals that are part of the system, right? An example of reviewing the analytics so created on such a data source is in the following visual that you see down below. Visual 2 is an example of a discharge planning huddle where you'd typically like to study average length of stay, slice and dice the data by different types of variables that influence the length of stay, and then be able to study that, report on that, and discuss that as part of your huddle experience. Right? These huddles are typically patient-centric, um, and these would require a patient's data to be available at your fingertips. It could either be inputted through some kind of a Power App form, or it could be brought in directly in sort of the run approach through your system of record. Format number 2 is this concept of safety huddles that I briefly introduced earlier. And here's a flavor or variation of a safety huddle. Safety huddles are typically done in order to um, study some operational metrics around patient safety. This could also trickle into a provider and staff safety. However, the example that I'm going to talk about is this concept of preventing falls on the clinical floor. Right? What we've done essentially here is we've brought in manually reported data, mapped it to a floor map on a hospital. So here in this case, you can see that there are different floor regions. Let's say in this case, on the 4th floor, there are 4 different regions, and each region is audited for how many safety issues have happened on a different bed, right? It's as simple as that. In my case, I've sliced for falls that I'm looking at, or I'm trying to study on each of these beds on the 4th floor with the ability to slice and dice data. The core concept here being, I want a place for people to be able to take actions back and do something about it, right? An action could be something as simple as making sure that the floor is dry, or something as simple as making sure that the blinds are down during sunrise and sunset times, right? These could be some takeaway action items that you can obviously stitch into an adaptive card or some kind of a task board using Teams. But again, format number 2, um, huddles that involve gathering data either reported through some kind of manual reporting or some kind of an automated sensor-based technology bring that into a discussion. That's kind of the next format. Here's a generic example of what you would use in Teams to create um, an end-to-end mapping of a workflow. Hand hygiene is something which is very common in the healthcare space, and adherence to hand hygiene is a prerequisite at most, if not all, elements of a healthcare system. Right? So what we've built here is a three-part solution to that problem. Part one being the ability to capture data, part two being able to store that data in a meaningful fashion, and part three being the ability to draw insights from that data so that you can study, you can slice, dice, report on, and you can act on that data that you've so recorded in order to make meaningful actions. Right? So in this case, I'll quickly walk you through, and if time permits, we'll have a look at a live demo. The concept is coming in, you can essentially, at a kiosk or at a shared workstation, you can simply go ahead and select one of your locations. Once you've selected your location, you can decide what type of an observation you want to report. And the type of observation you want to report extrapolates obviously beyond hand hygiene. You could think of any noticeable or any observable activity that needs to be reported out. All of these activities are stored in a relational database behind the scenes. In this case, in a SQL database, but you could start with something as simple as a SharePoint list. And again, that database is then connected to an analytics engine. In this case, that analytics engine is Power BI. And notice how this visual lets me analyze by location, by persona, by floor, by type of activity, how I can build correlations, and how I can slice data and figure out where I need to improve a scorecard. That is an extremely important thing in healthcare, right? So just to give you an example, um, this dashboard and the analysis of it is centered around a Teams meeting, typically in a huddle. Remember going back to that concept of different types of huddles. Anything we do as part of studying action items from these is based in a Teams meeting, right? So the concept of stitching it all together, we have one more example I quickly wanted to bring up here. Um, this concept of rounding is something that's picked up significantly, especially since the pandemic broke out. Rounding could be of different types. It could be a situation where you're doing your daily rounds virtually, or it could be a situation where um, nurses are rounding bed to bed and figuring out what type of a medication a patient is on, or what type of insights or action items are tied to a patient. So we're just simply introducing this concept of nurse handoff and being able to digitize that experience in a way that allows for utilizing the building blocks of teams, um, in a way that you can do quick and easy handoff of action items that lead to the eventual better care of a patient, right? I've embedded a video in this, a quick video in this presentation. So I'll just quickly go through little by little, um, like a quick demonstration of what this might look like. You would notice that the app in itself allows for tracking of equipment, of medication at different location in the hospital, being able to match in real time where an excess or shortage of some kind of an equipment is, and being able to provide ways of sourcing either equipment or medication from a place where there is excess to a place where there is scarcity of that resource. Again, all of these things, when in real time, these add up in a way that allows for better patient care. So just to give you an idea, different variations of rounding are also something that we typically like to study. I want to quickly pivot and maybe spend a moment on how do you bring it all together with an example of a end-to-end implementation of a care team huddle. So what we'll look at is sort of the end-to-end implementation of all of these different components when stitched together what can they look like in Teams? Now, I'm not working with live data, so just keep that in mind that some of what you see, some of the text and actions that you see here are not real. So this is dummy data. So the idea here is this concept of a care bot that we've so generated. The care bot comes in the form of a personal app in Teams. Remember when we initially kicked this off, we talked about different building blocks of what could make a Teams application. A personal app is one of those cases or one of those situations. You could layer a personal app with different other elements as well. So in this case, the CareBot is my one-stop shop for being able to chat and interact and retrieve some information about a patient. Okay. So using the CareBot, I can obviously click through and interact with the bot element. I also have a centralized dashboard where I can study aggregate statistics around number of admissions, about adherence to activities that are tracked on the floor, like teeth brushing, ambulation, inpatient infection cases, things like that. So I have the ability to study the dashboard corresponding to the facility that I work out of, as an example. And I do have the ability to scroll through a variety of applets, if you will, or widgets, if you like to call it that, in a way that aggregate data is displayed on top of each widget in a way that you can double click on it by clicking on details if you wanted to. However, if you need a current snapshot of the health of your clinical facility, you can get it simply by clicking on the dashboard menu on the top. As a user that interacts with the system, I do also have the ability to toggle on or off each of these different widgets as part of my experience. So I could decide if I want to study X out of the Y, you know, total number of items that are um, available to study. So in this case, if I wanted to, I could customize the look and feel of this dashboard for my own needs. The way to record, remember, the first part of the huddle is always capturing the backlog. So the way to record some of these data points could be gathered through a pop-up in Teams simply by providing like a little um, window for the individual to go in and submit data for the day. In an ideal world, much of this data is pulled from a different system, most likely the EMR. But just know that as an intermediary step, you might want to invite or solicit inputs in a manual fashion by somebody who already owns this process, right? Next up, we have this concept of tasks. So the concept of tasks is straightforward. You should have the ability to put everything out in the open, what's being worked on and what requires intervention or activity from people, right? So in this case, you can create variety of categories of tasks. This is very similar to a planner like experience whereby you could create like a backlog of items corresponding to each category of either specialty or ownership, um, people who are eventually required to um, act on it and so on and so forth. So this concept of task board is pervasive in a sense that you can fire it from not just the personal app experience, but you should be able to create a task from a message or a chat extension. Creating a task is straightforward. This is akin to how you would create one in Planner. Um, Add a title, add a due date, select a priority or another type of metadata, and then you enforce, who's the person responsible for delivering on it, as well as a description of the task in itself. Obviously, the tasks need to be able to move between categories so that somebody who's responsible for the overall thing can manage tracking and can manage ownership. Notice that once I went back there, this concept of assigning tasks to somebody, this is akin to also notifying them in a way that you're calling them out. The way to accomplish that in Teams would be to notify them and to send them reminders. Again, using the building blocks that already exist in Teams, we're going to mimic what would have been an in-person experience of calling somebody out, right, by task assignment. Just to move things along a little further, one of the most desired and well sought after requirements for such an experience is clinicians always tell us that they don't want the additional task of submitting patient information or filling it out in a duplicate system. So we do have ways in which we can pull data, certain elements or dimensions of data from the EHR or EMR system. In this example, what we're doing is we're basically bringing in data about an individual, all of their encounters, their appointments, anything they've sent or received in their inbox. All of those things are brought in an object. You would typically create a FHIR connectivity if Epic or Cerner is used as an example. We do have the concept of a care team, i.e. members who are responsible for taking care of this patient, who would be notified in case any activity happens corresponding to this patient object, right? So in this case, you can see that there are certain members of the care team with different designations, and their presence is listed out here. Very often in a hospital system, you have a case where people are on or off shift, so you need to know when somebody is available. We've also stitched together the concept of tasks corresponding to a patient. This is just suggestive data, as I said. However, the idea here is if a task needs to be accomplished in order to progress a patient in their care journey, that task would show up here, right? So all care team members responsible for all tasks corresponding to a patient give you the patient snapshot here. And then the care team gets notified every time a task or an activity corresponding to a patient is accomplished. So I have some of these things that I was talking about queued up. I just wanted to open up, in a live fashion, what you could set up within the construct of a team, right? So in this case, for example, I have a team for a children's hospital, and I'm going to monitor event um, quality. These events are specifically studied around patient safety. And these are reported out by individuals using a Power App form and mapped to a floor plan corresponding to um, sort of the floor that I'm managing. In this case, you can see um, the visual that I'm talking about here is the ability to create thresholds and notify relevant people when a certain threshold is breached. So for example, if a wing on the floor reaches a red, it means that the threshold for a number of events has crossed and that a set of individuals need to be notified. If you wanted, you could also layer up some of these analytics with correlations and data that would lead to something meaningful. So in this case, something like a distance analysis um, for pain scores or fall scores, and how many violations are incurred in this case, right? An extrapolation of the same concept is a virtual tumor board. Many of you are familiar with tumor boards, where oncology cases are studied and discussed by a variety of specialists. So here's a quick example of within the construct of a team, setting up analytics corresponding to a tumor board, and then operating on those analytics in a way that makes sense, right? So you could queue up your following tumor board in a way that allows for handpicking cases that would qualify based on certain quantitative thresholds, and then huddle around it for a more qualitative discussion amongst all the specialists that are typically involved. So